Bone marrow transplantation is currently the only known cure for sickle cell disease. It involves replacing the abnormal stem cells residing in bone marrow with healthy cells from an eligible family or relative. This procedure is also sometimes called a stem cell transplant. Medical experts warn people who may be contemplating a transplant that this is not a simple process. Dr. Annette Ofunne Akinsete is Chief Executive Officer and National Director of the Sickle Cell Foundation, Nigeria. She joins us now to discuss the bone marrow transplant program for sickle cell disease treatment, other innovative steps in the management of the disease, as well as the need to intensify awareness campaign to prevent sickle cell. Good day and welcome to Newsday.
Thank you so much. Thank you. I'm so glad to be here. Thank you for having me.
Okay, so from what we read, bone marrow transplant is not an easy procedure. It's not something you just go through. Can you tell us a bit more, about it?
Yes, it's not a stroll in the park. Having said that, I just want to say also that we're very happy, very excited, thankful that we have that here in Nigeria now. Okay, actually, the very first one was in Benin. But due to sustainability issues, it ran into some problems. However, here we are, Sickle Cell Foundation Nigeria. We are a not-for-profit, we're a non-profit NGO, but we're the very first NGO in the whole of Africa that will initiate, such what I would call a collaborative partnership between us, Lagos University Teaching Hospital, and Vanderbilt University Medical Center in America to establish this state-of-the-art bone marrow transplant center. Yes, bone marrow transplantation is the established cure for sickle cell. It's a cure for sickle cell. It used to be said that sickle cell had no cure. In Yoruba, they would say it's Akinsete or Bogun, that is, it's incurable. But that is the established cure for sickle cell. There are others that are supposed to be somewhat experimental, approved in some parts of the world. By that I mean you have heard of gene therapy, for instance. That is also one of the, we discussed it yesterday, for instance, at a conference that's going on right now. Now it is the cure for sickle cell. It is here in Nigeria. Nigeria really needs to have such a program because Nigeria has the highest burden of sickle cell in the whole world. They call us the sickle cell capital of the world. True, it's not a stroll in the park. It's not easy. Before the 2 patients we've just done, yes, we have succeeded in transplanting 2 patients, and they're fine now. They're doing very well. One is a pediatric patient, 7 years old, and the other is about 21 years old. So we've done an adult, we've done a child, and they're doing well. Fantastic. However, it is not a stroll in the park. We went through a period of months to get them ready for the procedure. Having said that, after the procedure, they're prone to infection, so you really have to guard against that. That is what tends to kill them, the complications that happen after the procedure. However, if you do have a good program like ours, we're sure of safety, we're sure of safety, and what we say in our facility here is all our specialists are on board anytime T, quality and safety. So with that, we can go to the bank with our program.
And is this something that is quite expensive? I know that gene therapy is quite expensive. And what candidate of sickle cell patient is eligible for such? Is it something you have to catch when you're young, or can the older patients explore such?
Good question. Well, it's expensive. Just yesterday, they were telling us at this conference that gene therapy is over $2 million. Over $2 million. But even bone marrow transplantation, which you've clearly stated here that stem cell transplantation is actually the general terminology, there are other sources of stem cells. Stem cells, as the name implies, can break out into and become any kind of cell you want it to be. So the bone marrow is one source of stem cells, but there are other sources, like the cord blood, even the peripheral fluid and peripheral blood is also another source of stem cells. But the best stem cell source of stem cells for sickle cell is the bone marrow, and that's where we're doing that. It is also expensive. In America, it's as expensive as $1 million. So from $250,000 to $1 million. That's how much Nigerians who travel there actually pay to access the procedure. And it is a procedure, it's not surgery. It's like blood transfusion. When you get the marrow from the donor, it is liquid, it's like blood. And you just bag it and transfuse it into the recipient. But you would have prepared the patient We have prepared the patient's marrow. That's what our experts do. The hematologists, the stem cell experts, they prepare the marrow to receive the donated marrow from the donors. And so when it's infused, they know where to go. Those cells know where to go. They go to the patient's marrow and begin to populate that marrow. And after we've tested the patients down the line, a couple of months later, we see that the patients and the donors' cells are actually high. And that shows us that the patient has what we call that chimerism. The graft has taken. We transplant in our protocol just children and young adults because they are easier to, we have less complications with younger people. Your question is valid. The older the patient, the more entrenched they are in themselves, and the more likely they are to reject a graft. So children are easier to deal with.
Now, earlier you talked about the risk of infection, for the patients, but I'd like us to talk about the donor. Are there any risk, for the donor?
Very good question. And indeed there is. Seeing the couple of patients that were just transplanted, I looked at both donors and the recipients. The donors actually went through more pain.
Wow.
Because the bone going through the bone to harvest the marrow. It was done under local anesthesia actually, or under general anesthesia, because it is a painful procedure. But within 30 minutes, you're done. However, after that, the donor can go through, some pains. The young boy, by the next morning, he actually stayed in overnight on a ward. The young boy, he was the donor for a pediatric patient, was fine by the next morning, but the older gentleman had a little more pain for a few more days. But besides that, okay, pain, yes. But also, if you're going to, go through tissue, there's also the risk of introducing infection. So there's also that risk of infection for the donor as well. If you're going to pass through tissue, you may be introducing infection, or bacteria or any other kind of microorganism. So there's a risk of infection for the donor as well. Very small risk, but it's there. Pain, however, is what we worry about most, to be sure that they don't go through so much, because they're doing a lot to help, to save the life of their loved one. So we don't want to put them through so much trouble.
Fair enough. And Nigeria being the capital, or having the most sickle cell patients historically, is a worrying situation. I know growing up, there was so much awareness about it. If you didn't have someone in your family who had sickle cell, you're going to church and they're talking about it, or everyone knew their genotype. Like, I didn't know what a genotype was, but I knew I knew what mine was. And as you get older, it seems like awareness for sickle cell has kind of decreased because there's so many other ailments that have come into the fore. How are they going to engage the youth to discuss sickle cell more for awareness? I don't know if you've watched the Netflix TV show. It's called Super Cell. It's based, I'm sure you've heard of it. It's based on sickle cell patients having superpowers, so to speak. Not to ruin the plot of the show, but it sparked a new sense of discussion about sickle cell amongst a group of individuals, younger individuals. That probably wouldn't be discussing it. So are there any more ideas on awareness? Because it seems like that's the issue, like the lack of awareness, and then the disease just continues to...
I'm really surprised to say so. I would have thought it was flipped, because I think awareness is actually increasing.
Okay.
Oh, certainly, because when I was a medical student, sickle cell was a pediatric disease. It was found really in children. We didn't see them more than 5 years, 10 years. It was the usual thing to say, oh, by the age of 16, they're gone. But now, I think over the years, a lot has happened in that space in terms of awareness. And there are even many more, not-for-profits, NGOs, advocacy groups, support groups who are out there pushing for, like us, pushing for awareness, raising awareness, working with government, ensuring that government has brought out policy. I'm even saying that policy is not enough. We need laws that will back those policies, to give the policies bite, if you like. Policies are fine, but if they're not implemented, there's no punishment. But if you have a law, there'll be punishment. So the government has a policy now that speaks to prevention, that speaks to treatment, care, support, and even cure, which we don't have, but Sickle Cell Foundation Nigeria and Luth we have established this cure. And that's the apex.
I guess I
of the
only
pyramid.
asked that because the numbers keep increasing. It's not
The
something that
the
has.
numbers have been there. The numbers. Okay, let's go back to how it came about. It was actually eons ago, millennia ago, that there was a mutation, change in the kind of genetic makeup of those of us who live in this part of the world. And what I like to say is, if you look at the sickle cell map of the world and superimpose it on the malaria map of the world, is one and the same. So we find sickle cell epidemiologically wherever there's malaria across the tropics, West Africa, Central Africa, down to East Africa, the Asian subcontinent, down to Indonesia, the Indonesian archipelagos, those islands. So it's not only a black man's disease, as I tend to say. It's us in the tropics, okay? And that is because nature found a way to save itself. That is, to keep the species going and so that we're not extinct. And that's because nature found that those who were AA were prone to die from malaria. So, but those who had the trait, survived malaria. So to keep the species going, nature thought, okay, this is the way to go. But I don't think nature reckoned with S and S coming together to form the SS status, But that's what we have today. Okay. That is how it came about. And now, in Nigeria, I think more than ever before, we are increasing, our knowledge is increasing. Even the names are increasing. I said the other day that the Yorubas have a way of, the language evolves. Now they have a term for sickle cell, and they call that sejedole, that which makes the blood weak or lazy, speaking to the anemia of the condition. In the 80s, when we went out for a survey across Nigeria, people did not bring in their children because they were hiding their children. We had a survey all over Nigeria to determine how much sickle cell we had. This was in 1988, 89, 90. But now, if we go to the communities, they're bringing out their children. They know the name. There's name recognition. My child has sickle cell. My child has only sejedole, So people know more. So I would disagree with you there that perhaps in your own space, you had the advantage. You were blessed to have that opportunity. So I think we're doing more now in terms of, but we have to have the right education, because I know that churches are asking that couples not be married if they are carriers. And I don't think that's the right way to go. They should come for counseling.
I was just about to ask you, about carriers getting married. Mm-hmm. I heard, that there's the option, of screening in pregnancy to, find out if the should I say, the fetus or the unborn child, would have the sickle cell disease. And in some cases, they can decide to terminate, and then have another one, hopefully maybe they will get an AS or something. But is that really advisable? Is that really advisable?
You see, we have, that's called prenatal diagnosis. Okay. Before birth. And we offer that service in our center. But we look at it as a form of early diagnosis. Because that's really what kills our babies before the age of 5. Because about 150,000 babies are born every year in Nigeria with sickle cell. And more than 100,000 of them die before the age of 5. And it's infection that kills them. So we want to catch them early. And why we worry is that a baby who's born today, who has sickle cell, looks exactly the same as one who does not. They're just, because they have the kind of hemoglobin, the problem is in the hemoglobin that they have in your mother's womb. It's called the hemoglobin of the fetus, fetal hemoglobin. So they do so well until around the age of 7 months, 8 months, 9 months, when the child's own genetic makeup begins to show up. And then the sickle cell begins to show, the child begins to have anemia, swollen hands and feet, and all that. But when we get them early, within the first couple of months, we've already instituted preventative measures in form of penicillin to prevent infection, in form of vaccinations to prevent infection. We want to be sure they do not get infection that kills them. So we catch them early diagnosis. So that's what we offer at our center. So in early pregnancy, in the first trimester of pregnancy, a couple can determine the genotype of their unborn child before, like 9 weeks, 10 weeks, 11 weeks. But about 30 years ago, looking at the data, the early years, I found that many women, many couples terminated their pregnancies. But I noticed in the past 5 years or so, they're keeping their babies because they know that there are better treatment protocols now. They're doing better. We have persons with sickle cell who live up to 70, 80, 90.
So just to be clear,
yes.
Are you saying that people can go ahead and risk it, AS partners?
Call it risk it, no. I would say come for genetic counseling. genetic counseling. So couples who are ready to walk up the aisle, it's never too late, but somewhat late. The best thing which we are doing, hand in hand with governments, is to ensure that persons know their status early on. So we're catching them young. So, and that is why government has come up with the newborn screening program. It's still in its infancy. It should be all over Nigeria so that every child who is born is tested for sickle cell. And it's not just for you have sickle cell. If you are AS or AC or whatever. So you have a card that shows that this is who you are. And then as you're growing older, perhaps that also forms part of your conversation by the time you start dating and all that. That is newborn. What we have found is that in our country, in Nigeria generally, testing for newborn and ensuring newborn screening has a lot of challenges. So we have expanded it to under five screening. So because immunization clinics are very robust. So we catch them at those immunization clinics and ensure that we test them at that point. So it's under 5 testing. And then you catch them also in primary school. That's another way you can catch them. Secondary school, university, youth corps camps. So you have all the opportunities. You don't want to miss them. You want to make sure you seize the moment, catch them and test. But more than anything else, counseling. Even if you're ready to walk up the altar, come for genetic counseling. And the counselors know what to do. They tell you everything, no sugar coating. They tell you as it is. They get others who have experienced it to share their experiences with you. And my students in the College of Medicine have determined that 8 out of 10 couples who are properly counseled will go their separate ways. But the other 2 out of 10, you still have to let them know what options are open to them. So what this said, prenatal diagnosis is one option. Another option is pre-implantation genetic diagnosis. It's available in Lagos, it's available in Abuja as well. However, these are things that are fraught with religious and ethical considerations, because that's something, pre-implantation, because it involves in vitro fertilization. So before the mother is even pregnant, the egg and the spermatozoa are mixed in the laboratory, and embryos are formed, and embryos are tested. So it's only those embryos that do not have sickle cell that are infused into the mother, and she carries to term. But that means you're going to discard some. And that's why I say it's fraught with some ethical and religious considerations.
And I'm sure it's expensive too.
It is very expensive. But it is here. It's available, and some Nigerians are accessing it. But again, at the end of the day, this also came up during discussions yesterday, it's the couple's choice. There are couples who face you at counseling and say, you have no right to tell me what to do. I just want to be with this lady, and I want her companion. We're not having children. It's none of your business. So and then there are also options of adoption. And adoption is getting more popular even here in Nigeria. So when they tell you we're not going to have children, you say, okay, just in case, this is available, this is available, this is available. Okay, so we do all of this in our center at the National Sickle Cell Center in Surulere, Lagos. I don't know if you've been there. I'd like to invite you to visit.
Thank you.
And visit our state-of-the-art bone marrow transplant center. That's what I always say, that is the power of partnerships. Because initially we were told to do it on our own. We should employ doctors, No, but we have Lagos University Teaching Hospital across the road. Their hematologists are there. So we partnered with Luth and partnered with Vanderbilt University Medical Center. So here we are.
Isn't science amazing?
It is, isn't it?
Super informative discussion this afternoon, Dr. Annette. Thank you so much for joining us. And once again, she's the CEO of the National Director of Sickle Cell Foundation of Nigeria. Thank you so much for joining us.